Good afternoon. My name is Monique Rodgers-McMillan, and I'm honored to present my capstone project, the TESC Leadership Model. This framework represents both my academic journey and my professional experience in healthcare administration. TESC stands for Transparency, Equity, Sustainability, and Collaboration. Four pillars that I believe are essential to leading with integrity and measurable impact in today's healthcare environment. The purpose of this model is to provide healthcare leaders with a structured, values driven framework for decision making. My objectives are threefold. First, to improve stakeholder engagement across clinical, administrative, and community settings. Second, to align leadership practices with civic and global standards. And third, to drive measurable outcomes in areas like financial stability, legal compliance, and ethical care. This model is both aspirational and actionable, designed to support leaders at every level of the healthcare system. Leadership is not just about titles, it's about competencies. The TESC model integrates key leadership competencies such as strategic communication, ethical decision making, team building, and change management. These competencies are mapped to real world healthcare scenarios, ensuring leaders are equipped to respond to challenges with clarity, empathy, and resilience. My own career has shown me how critical these skills are, whether guiding admissions teams, managing compliance, or engaging communities. Let me share a story. Imagine a mid sized skilled nursing facility in Maryland. The administrator receives notice of a compliance audit after patient complaints about delayed medication delivery. Staff morale is low, turnover is rising, and the community questions the facility's commitment to ethical care. I've lived scenarios like this. As an admissions coordinator, I saw how transparency with families built trust, even during difficult transitions. Later, as an administrative manager, I learned that equity in staffing and sustainability in operations transform morale and outcomes. In this scenario, the TESC model guides leadership. Transparency means sharing audit findings openly with staff and families. Equity ensures all patients receive timely care. Sustainability is addressed through workforce retention plans. And collaboration brings administrators, clinicians, patients, and regulatories together to co design solutions. By applying TESC, the facility not only resolves compliance issues, but rebuilds trust with patients and the community. Risk identification is a critical component of leadership. Using a risk matrix, I categorize potential threats: legal, financial, ethical, and operational, based on likelihood and impact. For example, regulatory noncompliance is both high impact and high likelihood, requiring immediate intervention. Meanwhile, reputational risk due to poor community engagement may be lower in likelihood, but still significant in impact. This structured approach helps leaders prioritize resources and build resilience. Here are four strategic focus areas aligned with the TESC pillars: ethical care, legal compliance, financial stability, and quality improvement. Ethical care is supported through DEI initiatives and ethics committees. Legal compliance is reinforced through policy alignment and audit readiness. Financial stability involves predictive budgeting and value based purchasing. And quality improvement is driven by Lean Six Sigma projects and performance dashboards. These strategies are designed to be scalable across healthcare settings. Effective leadership requires meaningful engagement with diverse stakeholders. The TESC model centers administrators, clinicians, patients, regulators, and community members, each with unique needs and perspectives. Administrators provide strategic oversight, clinicians deliver frontline care, patients offer lived experiences, regulators ensure accountability, and communities build trust. By integrating these voices, leaders can make decisions that are inclusive, ethical, and sustainable. This slide brings the model to life through action. Communication means sharing performance metrics transparently. Decision making involves using data to guide ethical choices. Team building fosters interdisciplinary collaboration. And change management supports transitions like new policy implementation or crisis response. These competencies are not abstract, they're embedded in the daily work of healthcare leaders and reinforced by the TESC framework. Before developing TESC, I began with a foundational model rooted in 5 values: vision, inspiration, honesty, support, and communication. These values shaped my early leadership philosophy. However, through academic research, professional reflection, and stakeholder feedback, I realized the need for a more structured, scalable framework, one that could guide leaders across diverse healthcare settings. That realization led to the evolution of TESC. In practice, I've already applied pieces of this model. For example, I introduced transparency dashboards to improve reporting and equity-based hiring to diversify staff. These weren't just strategies, they were reflections of my personal commitment to fairness and accountability. The TESC models formalizes what I've been building throughout my career, making it transferable and measurable for broader healthcare leadership. Leadership must extend beyond the boardroom. The TESC model supports civic engagement through public health outreach, education partnerships, and community wellness programs. Globally, it aligns with WHO standards, international ethics initiatives, and global health equity efforts. This dual alignment ensures that leaders are not only responsive to local needs, but also connected to global movements for justice and care. Here's the full TESC leadership model. At the center are the 4 pillars: transparency, equity, sustainability, and collaboration. Surrounding them are key stakeholders: the administrators, clinicians, patients, regulatories, and community members. The outer layer shows the outcomes: financial stability, legal compliance, ethical care, and quality improvement. This visual framework ties together values, actions, and impact in one cohesive model. In conclusion, the TESC leadership model offers a structured, values driven approach to healthcare leadership. It empowers administrators to lead with integrity, engage stakeholders meaningfully, and drive outcomes that matter. This capstone is more than an academic milestone. It's a reflection of my journey as a healthcare professional, a community servant, and now a future licensed administrator. The TESC leadership model is my legacy in progress, a framework that blends compliance, expertise with human centered leadership. Thank you for joining me on this journey. This final slide includes the references that informed my research, including CMS guidelines, NAB standards, ACHE competencies, and peer-reviewed literature in healthcare leadership and ethics. These resources provided the foundation for the TESC model and ensured its alignment with best practices and regulatory expectations.